Hi, this is Dr. Bhargava. In this short video, I have several interesting cases to share with you. This is our first patient. They presented with a right lung nodule, which was biopsied, and a neuroendocrine tumor was found. Patient underwent a whole body dotatate PET CT. We are looking at the rotating image on the left, which shows physiologic uptake in the pituitary, some uptake in the salivary glands, spleen more intense than the liver, physiologic focal intense uptake in the adrenals, and excretion from the kidneys into the urinary bladder. There is physiologic bowel activity, there is symmetric uptake seen in the hyla, and there is focal intense uptake seen in a right lung nodule. Here is the nodule in the right lung, which shows focal intense uptake consistent with a neuroendocrine primary in the right lung. The scan shows that there is no evidence of metastatic disease. And the interesting finding here is uptake in bilateral hilar lymph nodes, which is mild in severity or intensity and symmetric in distribution, as we see here, the left hilar, the right hilar, and the subcarinal region. So the question is this metastatic disease? Probably not. This is probably granulomatous infection or inflammation in the chest, which is taking up gallium labeled dotatate, and there is a mild uptake. Here is a related article, Normal Variants, Pitfalls and Artifacts in Gallium-68 Dotatate PET CT Imaging. It's important to remember the physiologic distribution of any radiopharmaceutical to be able to comment on pathologic uptake. This is our next patient. Patient underwent a pharmacologic stress test, suspected of having coronary artery disease using LexiScan or reg adenosine. And here there is no definite evidence of reversible defects. Maybe you can say that in the anterolateral wall here there is some reversibility, which is also seen right here on the horizontal long axis images. But the interesting finding, or the finding that alludes to induced ischemia, is transient ischemic dilatation. So if we look at the cavity size here towards the base at stress, it is larger compared to the cavity size at rest. Similarly, the same finding is seen right here on the vertical long axis images and the horizontal long axis images right there. Cavity size is larger at stress compared to rest. This is called transient ischemic dilatation and corresponds to more severe or multi-vessel coronary artery disease. So TID was seen in this patient, and also on this rotating image, we find that the TID is visible on this rest image compared to the stress image. And so usually in a one-day protocol, we use a lower dose at rest. So the rotating image on the left is more pixely compared to the stress rotating image on the right, which has more counts because a 3 times to 4 times higher dose was used for this acquisition. So the interesting thing here is that the TID is seen on the rotating images as well. And if you pay attention, you will find that a lot of times when TID is seen on the cross-sectional images, you can pick it up on the rotating images as well. And this is a CT on the same patient, and we can see here that there is multi-vessel coronary artery disease, RCA, LAD, circumflex. They all show extensive calcifications. This is an article on diagnostic and prognostic significance of TID in myocardial perfusion imaging, a systematic review and meta-analysis. And here the authors conclude that among patients undergoing myocardial perfusion imaging, the presence of TID is specific for detection of extensive or severe coronary artery disease. Here is our next patient. They presented for a FDG PET CT scan of the brain in the interictal phase. And we have 2 images, the CT image on the left, the PET image in the middle, and then a corresponding MRI from this patient's chart. So the characteristic finding in these patients when there is a seizure focus is that there is hypometabolism in one of the temporal lobes. So here we see that in the left temporal lobe, there is hypometabolism compared to the right side, and that corresponds to a focus of encephalomalacia and gliosis seen in the left temporal lobe, and that is the site of origin of their seizure focus. Here is a good article on this topic, and the authors summarize that FDG PET is an accurate, non-invasive method in lateralizing the epileptogenic focus in temporal lobe epilepsy, especially in patients with normal or equivocal MRIs or non-lateralized EEG monitoring. Thank you for watching.